It's a broad topic. So yes, it pertains to smoking and cigarettes, but it truly means all forms of tobacco. So that includes smokeless forms of tobacco and, the ever-evolving shift with vaping nicotine that's happening today, and how can we help support folks in reducing, stopping, or avoiding tobacco use altogether. It's really individual based. Of course, we have guidelines and we have practices that support people or that tend to support many people, but there is that individualized component when we're talking about tobacco cessation or smoking cessation. But some of the more general practices are that, we do have medications and cessation aids. So some of those being nicotine replacement therapies, which are ones that most people are familiar with. Those are like the patches, gum, lozenge, inhaler, and spray. And then we also have some medications, so things like Zyban or Champix are the brand names, but they can also be a part of people's recovery journeys. And then also, truthfully, medications only take us so far when we're talking about making any change, particularly something that might be addictive. So it's important to address some of those psychosocial, that whole model in terms of it. So then we use things as clinicians like brief interventions. If you're in nursing, you would know something like the 3 A's or the 5 A's in terms of how we ask questions to guide a conversation with people around changing that behavior. And then CBT and motivational interviewing in conjunction with each other can be really powerful therapeutic modalities. It has obviously the physical component with nicotine. So nicotine withdrawal is something that people can go through, but many people report something more mild like headache. But truthfully, with nicotine withdrawal, there's more of the psychosomatic sort of symptoms that we notice, or psychological symptoms. There's a relationship between tobacco use and other substance use, if somebody particularly was using it alongside other substances. Or it's the same process. So again, smoking one substance and continuing to smoke cigarettes could be really impactful. And it's important to underlying issues that people may have, right? So why are we doing what we're doing? And smoking and tobacco use can be part of our coping skills, and we can become overly reliant on those. And so when we're talking about tobacco cessation, what we're really truthfully talking about is how can we make people feel as though they have diverse tools that support them that aren't reliant on substances, whether that be for mental health or that be addictive processes underlying other addictions.